Hello, everybody. Welcome to another episode of Secrets of the Scalpel, Beverly Hills Plastic Surgery Exposed. I am your host, Dr. Ariel Ourian, double board certified plastic surgeon. We're excited for this new episode. We have a very special guest with us today. We have Dr. Hakim. Welcome, Dr. Hakim.
Thank you.
So we met initially by being in this building together.
Absolutely.
We're on the world famous Bedford Drive, where the biggest surgeons, doctors, dermatologists are all located in these 5 buildings on the street, the world famous Bedford Drive. So that's how we met. Tell us a little bit about yourself.
Absolutely. Thanks for having me. It's an
Of
honor to
course.
be here, and I'm blessed to have met you. We are neighbors in this building. This is what they call the Mecca. It's like the first
This is the
building,
Mecca.
the Mecca of cosmetics, which was awesome, and it's like the first hub, major medical plaza in Beverly Hills when it first started. So that's kind of cool. We met just as neighbors when
Literally.
you were building out. I was like, oh my gosh, this space is beautiful. Who's
You were
in this
building your
building?
space, I was building mine, so it's kind of
Yeah.
like perfect. We're at the same time.
Absolutely.
And I'm very grateful we met. We've been collaborating on patients together, so that's
Yeah.
wonderful.
Absolutely.
Tell us where you're from, where did you do
Yeah,
your training?
Sure. So I'm a double board certified dermatologist. I practice cosmetic derm predominantly, but also practice medical and surgical derm as well as Mohs surgery. I born and raised in LA, an LA
Me
native.
too. Beautiful.
Woo. I never thought I would live anywhere else. I did residency in Miami though, so that was awesome. Spent 4
Not-
years there, and it
Not a
was
bad place to be.
amazing. I feel very spoiled with warm weather. But I
Beautiful.
went to undergrad. I did my master's at USC. I went to Western University for medical school, and then Larkin Community Hospital in South Miami for residency.
Perfect. Perfect.
So that's great.
I am a Bruin, so I did go to UCLA.
Oh no!
But
Fight
it's okay.
on,
Listen,
Trojans.
you
Okay.
went to USC.
I
It's all
married
good.
a Bruin. It's okay.
Good. There you go.
We've got
And I
love
met your
for the
husband. I love
Bruins.
your
Yeah.
husband.
No, it's awesome. Both great schools in the Los Angeles area, so that's good.
Awesome. So now you're practicing here again, like you said, cosmetic and
Yeah.
medical derm. What are some of the most common things that you see? I know some of our things
Yeah.
overlap and we collaborate, but what are the
For
most
sure.
common things that you see in your practice?
Yeah, absolutely. So my practice is predominantly cosmetics. I have over 20 lasers. I love doing lasers. I love doing injectables. I'm a trainer for Galderma for those as well,
Oh, nice.
for
I didn't know
injectable
that.
trainings.
Cool.
So that's like the hub of what I do the majority of right now, especially like as summer is coming to an end. Many people are coming in to like clean up all their sun damage, and that's different patients have different skin types, so different lasers are better for some than others. So that's a lot of what we're doing, especially right now. That seems to be what's peaking.
Nice. Tell us. So I don't do lasers, as you know. Tell us. I surgically I can take out excess skin, for example, on the face.
Sure.
But when it comes to the quality of the skin, that's not something I can change surgically.
Right.
So tell us about like sunspots. A very
Sure.
common question I get: sunspots, hyperpigmentation, melasma. What are some of the
Yeah.
modalities you're using to treat this?
Absolutely. Right now, depending on a patient's skin type, that kind of dictates some of the lasers we use. In regards to sun damage, I have the BBL Heroic. It's Cyton creates this laser. It's one of the newest, most updated forms of light therapy for sun damage.
Okay.
And they did a study in Stanford before this launched, and they were able to show that the light was able to reverse some of the DNA changes from UV damage, which is really cool clinically, and the cells are acting more youthful. So not only at a cellular level can we correct some of the damage, but clinically the browns and the reds are all able to go, which
And
is
especially
huge.
here in Southern California,
sure.
we're always in the sun. And we're UV
For sure.
exposure is super high.
Yeah.
Except for me, I'm probably vitamin D deficient because I'm either in my office
We
or in the
all
operating
are.
room.
Yeah.
Let's talk about sunscreen. You
Yeah,
were telling me
absolutely.
sunscreen. What do you recommend? What are the regimens you recommend?
Yeah.
Tell us about SPF 50, 100,
Sure.
1,000.
Sure. So, it's funny you mentioned vitamin D because I think a lot of patients come in with the misconception of I don't wear sunscreen because I don't want to be vitamin D deficient. But sunscreen only lasts for 2 hours, first off. And then many patients aren't covering their full body in exposure. It doesn't prevent you from getting enough vitamin D. You can still get healthy amounts of vitamin D and still be protected by UV from UV exposure. The Academy of Dermatology has standards for sunscreen recommendations. So the main things we talk about is the SPF level at least 30 or above. Truly, once you reach 30 and more, there's minimal improvements.
So
but
kind
as
of
long as
plateaus
it
at 30.
plateaus
Okay.
pretty much at 30 and it's like a mild increase. So the higher the better. It's not harmful, but 30 is what's medically sufficient. Broad spectrum is important. So you want it to have UVA and UVB coverage, and then preferably a mineral. There's no absorption with that. Patients, like you mentioned melasma earlier, melasma can also be triggered by even visible light. And so mineral filters, including iron oxide, can actually prevent flare-ups due to even visible light and get more protection that way. So those are the main recommendations we usually talk about.
So SPF 30, mineral.
And
Is there
broad spectrum.
broad
Those
spectrum?
are the top three.
Is there any difference between the spray, the ointment?
Yeah. As long as you get it on, I always tell my patients the one you're wearing is the one I like because at least you have
Good.
something on,
As
right?
long
And
as you're
so,
wearing it.
exactly. But the things to just be careful with, and when you're at the beach, you see this all the time when people are spraying and you just see the sunscreen misting all over. It's not actually
Not
hitting
actually
them. So,
going
like,
onto your.
just making sure it's actually getting on your skin, close proximity, rub it in, maybe get someone to help. But as long as it's on your skin, I'm happy. I think the other biggest thing is that sunscreen only lasts for 2 hours.
That's key. So,
It's huge,
yeah.
especially during the summer. But we live in LA, so people are out all year long. When you're out, if you're outdoor playing tennis, hiking, going to the beach, you do need to reapply because it only has a lifeline of 2 hours.
Right. And let's talk about some of the side effects of being
Sure.
exposed to the sun, aside from the
Yeah,
cosmetic,
absolutely.
sunspots, dark spots, things like that.
All the
Let's
things.
talk
Yeah,
about skin cancer. So
absolutely.
it can cause basal cell carcinoma,
Squamous,
squamous cell
melanoma,
carcinoma.
those are the top three. There's a ton of types of skin cancers. There's over 100, but we know scientifically that the number one cause is UV damage. And so it's super important to just get in the habit. And this is like more recent literature. I think when we were kids, my
It's like,
parents
yeah,
didn't put sunscreen on
yeah.
me as much. It's more recent literature, but we do know that for a fact that UV damage does cause it. Squamous cell is probably the most common, and basal from sun exposure. Basal is the most common skin cancer that's out. But skin cancer in general is triggered by UV damage.
So it's also important to talk about getting frequent skin checks.
Yes.
Especially people who are prone to people who've had skin cancer at some point. They
Absolutely.
need to come in and get regular skin checks from head to
Absolutely.
toe.
Yeah.
And we're fortunate to be in an era where we have Mohs surgeons who can do excisions, and then we also have once the defect is created, they usually send.
Yeah.
We collaborate with Mohs and dermatology.
Absolutely.
Now we have to figure out a way to close this defect.
Exactly.
And it can be a challenge sometimes. We find ways to take
Yeah.
skin from one area, bring it to the other, and then make it look as natural as possible.
Absolutely.
So yeah, cosmetically, you want to look good. You don't want to have
Yeah.
damaged skin, but then also the cancer risk is huge.
Definitely. And we recommend everyone to get a baseline skin check once a year. For patients that do end up getting precancers or even skin cancers, that frequency goes up to 6 months, even 3 months, depending on the skin cancer. So early detection is so key. Even with the most deadliest skin cancer, which is melanoma, if you catch it early enough, 90% of them are curable. And so just like getting out there, getting checked is something that can truly save your life, and not ignoring something that's new, growing, changing is so important.
Let's talk about there's an acronym for a suspicious
lesion.
lesion,
Say, yeah.
a suspicious lesion. What are the
Yeah.
things we look for
Yeah.
in a lesion that may be, hey, this may be a melanoma, and to see a
Absolutely.
dermatologist?
Absolutely. So the acronym is fun. It's ABCDE, right? And so A is for asymmetry. And if you have a mole, if you split it in half, they should be mirror images. And if they're not, that should just warn you to get checked. I always don't want people to be like, oh my God, that must be a melanoma. It screens it to get fully evaluated. But, they should be mirror images. B is for border. So it should be a smooth border. If and border edge is growing or it's very uneven, they should be checked. C is for color. So multiple colors in a mole or something that's really dark compared to the rest of your moles should trigger a check just to see why. D is for diameter. The standard is 6 millimeters, which is the size of a general pencil eraser. Anything larger should get screened. And the most important is E. E stands for evolving. So if something started as a small dot and has grown, that's the most concerning.
Get
We know the
checked.
body is changing and we want to know why. Is it attacking it for some reason? Is it trying to clear it on its own and it can't? And so that's the most important factor.
And what you said is key, that these are 90% of these
Are
are
curable if they're caught early, which is huge because it can kill you if it's not. So it's something that as long as you're proactive and getting skin checks regularly, it can truly save your life.
So especially, again, we're in Southern California, exposed to the sun. It's really important for people to come in, get checked regularly.
Absolutely.
Let's talk about some of the other lasers. I've always been interested in this. This is something that, again, I essentially only operate, but when it comes to
lasers are my jam.
Yeah, tell me what are some of the newest
Yeah.
lasers that you're using other than, you said, the BBL?
The BBL Heroic is one of the newest ones on the in the medical market in general, which is really cool because it's another level of light therapy that uses magnetic technology to monitor the handpiece. So we're able to put so much more pulses into the skin at a safer level, and it's monitoring how much we're actually putting. So it uses a little bit of like AI magnetic technology to maximize treatments. But we have a ton of lasers. You know, there's standard wavelengths that have never changed. The technology just gets better and better and better in how we deliver it. We do a ton of resurfacing. I love the erbium system as well. It's safe
That's been like
for
a classic. It's been refined to the point where it is now.
exactly,
And you can do
exactly,
that awake in the
exactly.
office.
And a lot of times we partner with a lot of plastics. Sometimes, you know, we can do them in the OR when they're out just so they don't feel it. And that's been helpful for a lot of
Yeah.
patients because you're out anyways. So it might as well, you
Why
have the
not?
downtime, you won't feel it. And it's a great way to maximize on facelifts or any type of surgical treatments. They're also super beneficial for scarring. So with many scars with my Mohs cases or even surgical excisions that we do for mole removals, in general, with any type of scarring, a fractionated erbium is one of our go-tos to just minimize the appearance of the scar.
I'm so
Um,
happy you brought that up. I'm sorry that I've
yeah.
been talking about
No, I love it. Sure.
scars. Oh
Yes.
my God. This is like every patient I ever operate on is, how
Absolutely.
bad is a scar? How bad is a scar?
Yeah.
Especially, listen, on the face, on the
It's
breast,
important.
anywhere. Patients want to know, how bad is the scar going to be?
Yeah.
My son fell, and I would suture. I do a lot of pediatric laceration
Oh,
repairs,
yeah.
and the parents are like, "Oh my God, is this going to scar? Is this going to scar?" Let's talk about scars.
Yeah.
So
Absolutely.
what's important to know is, I always tell my patients that scars take 1 year to fully mature.
100%.
You agree to that?
I agree.
And it goes through different stages.
Yeah.
First you have it's nice and thin, then it
Mm-hmm.
starts to heal. It gets a little bit raised, which is normal. It gets red and purple, and then
Mm-hmm.
finally at a year,
Mm-hmm.
it's fully matured.
Right.
So, and something else I explain to my patients is, it's your genetics in addition to
Mm-hmm.
the surgical closure, the way the incision
Absolutely.
was closed.
Absolutely.
What are some of the things we know about genetics and
Yeah.
wound healing and scars and things like that?
Absolutely. Especially with genetics, there's a cell type called TGF beta. I feel like I'm like board exam again, but it's a
I am your
specific
board
yeah.
examiner.
It's a specific cell type that you're genetically predisposed to. And people that have a heightened amount of that cellular activity tend to have hypertrophic or colloidal scars. And so they also have something called dermatofibromas where like you get those little scar like bumps on your legs from
Yeah.
ingrown hairs or things, but that's an overexpression of TGF beta, but that is a genetic predisposition for a
To
lot of
having
patients.
scars, especially
Exactly.
African American skin with
Exactly.
keloiding. And there's a difference between
Exactly.
keloid and hypertrophic scarring, which we can get
Absolutely.
into. But
Absolutely.
some patients are true keloid
Mm-hmm.
formers, where the scar kind of extends past where the incision was, as
Exactly.
opposed to a hypertrophic scar, which stays within the borders of the
Yeah.
incision.
And it's so important. I always educate my patients, but that's a huge difference. And I
Huge
think
difference.
it's
And
a
the treatment is
misconception.
different.
Exactly. Exactly. And it's that cellular activity that's heightened. We don't know why certain people are more prone to those. And we do know the African American population tends to be more so than others, but anyone can have that. And so there's truly a genetic predisposition to that cellular type, but there's treatments for them. And I think it's important to know that the way you take care of a scar post surgery is super important. Silicone is
Oh, we're
great.
good. Yeah.
Massaging is
I
great.
love this.
Yeah.
Um, in terms of post operative scar care,
Yeah.
um, silicone is really one of the only things
Mm-hmm.
proven to
Exactly.
really, it's cheap, it's effective.
Mm-hmm.
Silicone, and the mechanism is, it hydrates the cells and it
Mm-hmm.
hydrates the wound, and it helps to enhance the healing. So
Exactly. Exactly.
silicone is key.
Yeah.
And
And as silly as massaging sounds, that has a lot of scientific research that
yeah,
backs it
it's
to
not
minimum.
silly.
Yeah.
It has a lot of scientific backing. And I usually tell my patients to massage it with bio oil,
Yeah.
which has vitamin E.
Mm-hmm.
You can wipe that off and then put your silicone cream of
Exactly.
your choice. So
Yeah.
you can go on Amazon and buy whatever it is.
Sure.
In my opinion, they're all created equally. I do like
Yeah.
the ones that have sunscreen built in.
Same. I was going to bring that up as the next thing because we were talking about how scars can look vascular, right? Whenever there's a wound, there's new blood vessels that approach the wound to heal it, and that can stain the skin and make it a little bit pink or purplish, even earlier on for some patients. But sun protection is huge because that post-inflammatory hyperpigmentation that can be created kind of holds on a little tighter when it's exposed to UV damage. So sun protection is super important
Is key.
is so key during scar healing.
I mean, especially when you're doing any sort of facial stuff.
Lasers as well. Whenever the skin just has any baseline inflammation, like patients freak out with acne too, because it leaves acne marks as well. It's
Yeah,
the same formation of that scarring, that post-inflammatory hyperpigmentation from lasers or surgical scars. Sun protection is so important because these things can fade naturally in that time
exactly.
span.
If you just take care of it the correct way.
Correct.
And the reason why I like the silicone creams that have sunscreen
Yeah.
is it's
Two
two
in
for
one.
one.
Yeah.
And I usually
Makes it
tell my
easy.
patients, use it twice a day for the first 3 months, usually at least 3 months.
I say the same.
And if you're going to spend all day out in the sun, I usually tell them, hey, do touch ups of sunscreen throughout the day. And
Yeah.
really, the sun in this case is your enemy
Mm-hmm.
in terms of proper scar healing.
Absolutely. And then we have like I do a lot of vascular lasers too for some of these scars because if there's blood vessels that have like
Little
kind of trapped,
capillaries and things like that.
exactly. You can take away the pinkness actually pretty early on. We can take that away relatively like within the first 3 months. I do treat vascular spots, or we can help the texture start to heal a little bit better too with like a fractionated erbium or something like that just to minimize it.
What are your thoughts on micro needling scars?
Yeah,
It's
also really great.
it's
Also really great.
something that's really kind of simple and easy,
Absolutely.
and again, it goes to just resurfacing and remodeling that top layer and causing more blood flow to go to it,
Yeah,
to that.
absolutely.
And so good, yeah. Scar care is like this is
Our
what
jam.
our jam. This is our lives
Absolutely.
is scarring and proper healing of scars.
Absolutely.
Tell me, I get a lot of patients who come in and ask me about melasma. Tell me about
Yes.
melasma.
Melasma, that little sucker.
That
It's
little
so
sucker
annoying.
is
Yeah, I
my
have it.
patient.
So
My
it's
patients hate it
frustrating. Yeah, it's very frustrating. The one thing with melasma is that once you have it, you have it. It is
forever.
not curable, but it's controllable. So I think that's so important to set the expectations with patients is I can make this go away, but if it's triggered, it'll come back. And so many patients get melasma because they have that genetic predisposition. There's a strong hormonal correlation for females that are either on birth control or switching birth controls or becoming pregnant, are pregnant. You have a trigger strongly associated with hormones, and sometimes it just happens. I had mine triggered from being in a hot class, like a hot workout class. I do a hot
Hot
yoga,
yoga.
and enough times my melasma presented itself, so it could just be the perfect storm sometimes. But the biggest thing is that obviously sun protection is number one. It's key to prevent it because sun exposure will trigger it. So no matter if it's clear and you have it under control and you go out without sunscreen, it'll show its face. And so it's so important to be sun protected. Talking about mineral sunscreen for melasma patients is crucial too for visible light protection. There's some recent science that has shown that even visible light from computers, TVs, phones can
Really?
actually trigger flare ups. So just, you have to be super cautious. And mineral sunscreens do have filters to protect against visible light. So that's helpful
Wow. Because we are on our phones all day,
all
every
day.
day.
Or if you're in front of a computer, if you have a
Computer,
desk job or,
literally all day, every
it's
day, and you're being
100%.
exposed to that screen.
And
Wow.
they've been able to prove that that's a trigger. And then the concept of heat, which I think people confuse with sun exposure, because obviously sun, people think it's hot, but truly heat, like hot yoga or a sauna, a steam room, even as like small as getting into a hot car in the summer on a summer day, and just getting into the heat can trigger it. Hot showers, if I didn't say that already. So it's important to realize some of those triggers to be preventative, but we have so many treatments in office. Um, I personally think it's super important to have a solid skincare routine that's quieting down the melanocyte to not trigger
What do you
flare ups.
recommend? Like, what is a proper skincare regimen?
Yeah, absolutely.
Kind of, what do you wake up? What do you do? What do you
Sure.
recommend as
Sure.
from like a professional dermatologist point of
Yeah.
view, as opposed to the things that people are
Just
finding
all the
on
trends online,
the
the
trends?
TikTok
I
trends.
saw a reel on this. Let me use this bronzer. Let me use
Absolutely.
this toner.
Yeah,
What do you
for sure.
recommend from the medical aspect?
Yeah. Medically for melasma specifically,
Or anything? Just what's a
yeah.
good skincare regimen that everybody can incorporate
Yeah.
into their lives?
Yeah. Well, just to touch on melasma, just from that topic point, the first line treatment for melasma topically, and that's medically been proven and researched, is hydroquinone. It's like tried and true. I personally like to combine my hydroquinone with a tretinoin and a colchic acid and maybe a mild cortisone just to monitor some of the side effects of it. But that's been shown and tried and true as a topical combination cream used in the evenings. Now, for just like everyone, I think the most important thing to do in the morning is sun protect. So obviously, washing your face in the morning is so super important. An antioxidant like vitamin C is really helpful just to help debunk some of the pollution and environmental changes that might be taking a toll on your skin in the mornings, followed by
Washing,
sunscreen.
but washing with what?
Yeah,
Drying soap, or what kind of
sure.
soap? What? non-scented, scented? What do you
Sure.
recommend to wash your
Yeah,
face in?
everyone's skin type is different, and this is something that is specifically catered. There's not a universal way, but what I always recommend is a gentle cleanser, fragrance free. No matter what your skin type is, you don't want to strip your skin or possibly cause irritation. Certain fragrances or harsher cleansers can do that, so
You can
it's
get like a contact dermatitis or everything
100%.
and get
Yeah.
allergic reactions to it
Yeah,
and stuff like that.
especially if you're sensitive skin. All my sensitive skin patients should not be on fragrance products or really strong soaps that have exfoliants or other ingredients that just your cleanser just needs to wash your face. Gentle cleansers are great. Vitamin C, there's many on the market. I think that's a ingredient that's a little challenging because many patients can't tolerate it. Speaking of sensitivity, if patients have rosacea or acne prone skin or just sensitive skin, vitamin C can be a little tricky because a lot of them it's a very unstable molecule, so it can actually trigger irritation in a certain patient population. So proceed with caution.
See with caution. So
Proceed
you're
with
so you're a
caution.
local
Yeah,
dermatologist.
exactly. Come see me. Moisturizer is super important. The skin has a skin barrier, and all of us have a skin barrier. And no matter what your skin type is, if that barrier is interfered or broken, you have the higher risk of flare ups of acne, rosacea, melasma, skin irritations. If that barrier is protected, your skin is in its healthiest state. So, there's a lot of sunscreens that have a moisturizer in it, and that can be a combined step to make it even easier
Perfect.
for the morning. And most of the gentlemen in my practice, that's all I try to get. Just wash your face and put the sunscreen on, and they're like solid for the day, and I'm
Done.
happy. Done. Easy. Takes 5 seconds. It's like literally the easiest thing. At night, one of the biggest steps to do, obviously, we want to start by washing our face again, but a retinol is like tried and true for it's a gold standard in skincare for anti-aging and just helping the skin be its healthiest and its thickest possible. It's one of the only topicals proven to also produce collagen from a topicals point of view. It's just turning that skin over so that healthy skin is coming forward, but in doing so that helps with fine lines, pigment, texture. If you're going to do anything at night, that would be the step, and I always recommend moisturizing after just because it can be slightly irritating for patients. But
So in a nutshell, that's
in a nutshell,
best
that is your
practice,
core.
core, easy to do. Everybody can do it. And
Yeah.
these are products they can buy easily on Amazon or at
Yeah.
a local
I
drugstore.
will chip in on Amazon because
Tell me.
Amazon is not regulated. And so, skincare specifically, any consumption of like supplements, skincare, medication should be careful. You have to actually look at this distributor because some of these companies that are medical grade companies and good skincare lines, they are one of the distributors on Amazon, but sometimes you don't know where they're coming from. And they have found like faulty skincare
Really?
products. So, just be cautious with all medical types of purchases, including skincare on Amazon. I always say go to the source,
Yeah. We have
medical
Sephora
offices.
here. We
Yeah.
have CVS. Rite Aid
Yeah.
is shutting down, but
Is
are we
it?
lost our Rite Aid on it? For those who are in Beverly Hills, the
No.
Rite Aid on Cannon,
I heard it went bankrupt, but they're still up and running.
they're done. Yeah, that was the only 24-hour pharmacy in our area. The Rite Aid, it's closed. It is, yeah. That place was
Well,
a
that's
huge loss.
actually sad.
Let's shift gears and let's talk
Sure.
about radio frequency and skin
Yeah.
tightening because this is
Yeah,
huge.
absolutely.
It's something I do surgically. It's something you do non-surgically.
Absolutely.
So let's talk about this topic. Okay,
Yeah.
so radio frequency. What does that do to the skin? How does it tighten the skin?
Yeah,
So from
absolutely.
a scientific perspective, how does
Yeah.
that tighten the skin?
I love that you brought up radio frequency. I think skin tightening in general is that one thing that like everyone seeks,
Everybody
right? And like
wants
whether they do it surgically or non-surgically, every day that's part of the conversation with patients.
literally every day.
Literally.
That
That is like the core. And it's hard because sometimes there's no other option. You have to cut the skin. But there are technologies. Radio frequency, I think, is the currently most studied for skin tightening in the non-invasive world. We also have ultrasound and infrared, and it's basically heating up the tissue to create the cascade for collagen production.
and that's the key in all these modalities
Actually,
is
exactly.
heating.
Exactly. And so there's that like window of that temperature, it's about 40 degrees Celsius, give or take.
Yeah.
But you want to hit this temperature to create contractions of the skin. It also creates that cascade for production of collagen and elastin. And it's kind of cool. You actually see it,
You can see it,
you
yeah.
see the skin tightening and contracting once that heat is initiated. But it's super important to go to someone that's certified like ourselves because
Go to a board certified doctor no matter what you're going to.
Exactly.
Please seek a board certified
Yeah.
physician.
Yeah, absolutely. I mean, these treatments are all medical and they do the right thing when they're done properly, but I
Or you can get
see
seriously burned, and because you have
absolutely.
people who are not certified, who are
Mhm.
non-practitioners even doing this, which is
I know,
really
it's really
dangerous.
scary. And putting it in the wrong areas. Like sometimes, we want to tighten skin, but if it's in a fat layer, it can burn, it can melt through fat. Sometimes we want that. And you have to understand
You have to
anatomy.
understand anatomy and be trained in it properly.
Absolutely.
So the way we're using it from the
Yeah.
surgical perspective, radio frequency is something called Renuvion J
Yeah.
plasma. It is, in my opinion, it's finally we've reached the point where the technology is so great. It's a
Amazing.
helium-based radio frequency device,
Yeah.
and it can essentially be used anywhere in the body. It is done at the same time as liposuction. So patients who have a little bit of loose skin and a
Hmm.
little bit of fat, but not extreme loose skin that would require cutting it out. So Renuvion J plasma is perfect for
It's
these patients.
amazing.
We do liposuction, and then in the same setting, there's another long cannula that's attached to the device,
Yeah.
that's attached to a helium canister, and you just run this cannula underneath the skin, and
Hmm.
also you can see the contraction on the
So cool.
table.
Yeah.
And the beauty of this is it doesn't end there. It gets better and better over the course of 9 to 12 months,
Absolutely.
where you're having the collagen grow, the elastin, and
Hmm.
it makes it that much better over the course of 9 months to a year. So
Yeah,
this is a
absolutely.
technology that's been around for a long time, but we've refined it. It used to be like laser lipo or all this
Yeah.
stuff.
Yeah.
There are still people using laser lipo, which is
Hmm.
ridiculous. Or like Thermi, but now we're at a place where Renuvion J plasma is
Yeah.
literally the gold standard,
That's
and
amazing.
it's something I'm happy to offer to my patients. I do it
Yeah.
most times when I'm doing liposuction. A majority of patients I will recommend some sort of skin tightening because
So
you,
important.
yeah, you empty out the fat. The last thing you want is a flabby kind of skin envelope.
Yeah. And I
So
don't think that was the standard decades ago. I
it
mean, you can speak
wasn't.
on that more than I can, but
Yeah,
I see patients all the time that came in post lipo that, now we're treating their skin. And so super important to do it at the same time. I'll do micro lipo cases in my office and you have to treat the skin. You want
you
it to be able
have
to
to.
bounce back to where that socket of fat or that pocket you've removed you got to correct it somehow for the skin to go back. So it's super important to put energy into the skin there.
I agree 100%. And
Yeah.
also, what's really important post lipo or body contouring is
Yeah.
compression.
Absolutely.
Because now that you've suctioned it out, you've done,
Well, now you can buy your compression from Skims, right?
yeah, maybe you don't even need any other, you don't need liposuction,
you
you
know.
don't need a facelift.
Oh.
Let's just all go to Skims and buy their little garment and put it on. I think I
Yeah.
mean, there is a role for Skims, that little garment, if you had
Post
liposuction.
procedure. Yeah,
Post
we
procedure.
always provide that for our patients. So,
Same in our practice. Also, we provide it to you, but
yeah,
for I don't know what Skims is claiming. Does this
I'm not sure.
replace surgery?
I,
It's like a little bit
no, I
in.
think it's like something you can add on in your nighttime routine, at least from. I haven't taken a deep dive to be honest, but yeah, obviously it's not ever enough. Like these are things we do post surgery to get to an endpoint.
Correct.
So it's
Post
not there to replace.
treatment, it's not there to
Absolutely.
replace, but yeah, we'll send them to
Yeah.
Skims
Just for their like post care.
post care.
At
But
least you can get one, your skin type, your skin color, your
exactly,
mask. They made them more fabulous.
and you support Kim Kardashian.
Of course.
But compression is very important in these after these procedures because, like you said, you've delaminated the skin or the neck or the abdomen. You've delaminated it off of those underlying tissues.
Right.
You've tightened it. You want this to stick back and
Hmm.
shrink back onto your body,
Exactly.
so it looks nice and tight. So,
Yeah.
skin laxity is something that we both come across every day.
Yeah.
And it's a challenge.
Yeah. And I think people just recognize it as like one of the first signs of aging.
Yeah.
Obviously, anatomically, there's so much going on underneath. But when you're clinically looking in the mirror, that's what people will point out. The jowl starting to fall forward, the deepening of your nasolabial folds, the
Yeah.
sinking of your eyes. But it's all truly like the loss of collagen and elastin, a loss of bone density, loss
Yeah.
of fat.
All of
And
the above, really. And
yeah,
like you said,
combination.
it's it's good that you mentioned that because even the bone, you get bone loss when you get older, and
Hmm.
really the foundation of the face gets sunken in. Then the fat, when
Absolutely.
we were discussing with one of my previous guests, we were talking about the GLPs and people losing weight.
Yeah.
Now you're losing fat, which
Hmm.
is one place you don't want to lose fat is your face. So
Yeah.
now you're losing fat, and then the collagen and elastin of your skin. So all these coming together, and age, and being exposed to the
Absolutely.
sun, all these things. Now we have this issue that we can,
Right.
again, it can be treated with non-invasive, with
Yeah.
surgical, and everything in between.
Yeah. And I don't know what you're doing in your practice, but in our practice, especially if patients aren't are on GLP-1s or are planning on it, we do come up with a plan, because the difference between fat loss when you're on GLP-1s versus just normal like aging and fat depression in the face is that it's all happening at once. And so you really get it.
Rapidly.
It's rapid and it's at once. Whereas
It's
naturally, there's phases in different areas. It's not as prominent. And so
it's
I
striking sometimes when
it
patients
really
come
is.
in. Some of my patients will go on a GLP, come back and see me after 3 months for some other issue, and then you're
Yeah.
like, oh my god,
It's drastic. And
it's
so
drastic.
if patients are, I try to have the conversation with them. If they're beforehand, it's best to like try to do something to keep some of the regenerative treatments going so that they're not losing as much fat and their bone structure is maintained. And this is through regenerative injectables we usually do in our office, but we try to have a standard set so it's not so much of a drastic loss, and we maintain as they're continuously losing weight just so their face isn't changing.
Right, Ozempic face is real.
It's real. It's real.
And I'm seeing a lot more patients who come in with that skin laxity, gaunt
Hmm.
appearance. I'm doing a lot more facelift these days, a lot more neck lifts,
Yeah.
and doing fat grafting at the same time. Fat grafting, we love fat.
Absolutely.
We,
I
we,
mean, it's
we
like the
love fat.
best
It's a
stem
love
cells.
hate
Yeah,
relationship.
it is.
But fat is great because it has regenerative properties. It's also
Absolutely.
can revolumize. I like to call it God's filler
Yeah.
because there's so many applications you can use it for. So you do a facelift, you dealt with the excess skin, but now to rebuild the foundation,
Yeah.
fat is such a great thing.
Absolutely. And I personally use a lot of polyalactic acid, in our practice. It's
Sculptra,
regenerative,
yep.
Sculptra.
Hmm.
It's regenerative, it's stimulatory, and
It has a safety profile that's been proven over years and years of
yeah.
use.
I mean, it's been out for like over 40 plus years at this point, like different, you know, FDA approvals, but it's been out for a long time, if
Right.
not longer. And, we know it's definitely safe, and we know it's stimulating your body. We know how it works. We know where it works. So important to go to, again, an experienced board certified provider, because it's
Where you're
important where it's
injecting it.
injected.
Yeah.
And I actually, I'm sure you see, everyone's done something, especially in the city, that's
Oh,
coming in for a
everybody's
facelift. It's not like you're getting a naive patient, but how do you take injections prior to a facelift? Do you have recommendations as to wanting to stop things before you do a facelift for a certain time period, or any criteria you recommend?
So, if someone has known filler and a lot of filler, I'll try to dissolve it before surgery.
Absolutely.
Certainly after like before a lip lift, I'm going to dissolve the filler.
Sure.
But if there's any like palpable areas where there's overfilled with filler, I'll try to
Yeah.
dissolve it first. Certainly when if someone who's had a lot of filler, when you go in for a facelift, you can see the little areas of filler that remain.
Mm-hmm.
So one thing that could possibly make it a little bit more difficult is something we don't use anymore. Like I know it's called Kybella. I
Mm-hmm.
don't know if you use that anymore.
I don't actually. I'll
Yeah.
just lipo
Yeah,
or send,
so that makes
if
a
it's
lot more
larger
sense
cases.
because
Absolutely.
Kybella leads to this crazy inflammatory response, and then when you
Mm-hmm.
go and try to do liposuction or try to do a facelift, it's like hell in there.
Yeah.
It's like a bomb went off. Things are very sticky. So
Mm-hmm.
Kybella is something that luckily is falling out of favor.
I agree.
So
I
Kybella
agree.
is terrible. In terms of fillers, this is really a podcast on its own about
I'm
filler.
sure.
There are so many fillers, and it's really depends on the experience of the injector. I
Mm-hmm.
think there are a lot of good products, and you can chime in on that.
Sure.
You have your favorite products. I have my favorite products.
Sure.
So people, whatever they're comfortable with, and know they
Yeah.
can get reproducible results. What are some of your favorites in
I'm a Galderma girly.
That's right, you're a Galderma trainer.
I don't say that just because I'm on faculty, but I like, over the last decade of using their products, it's tried and true.
Yeah.
Complication rates are the lowest amongst other fillers on the market. And no matter what products you're using, and it's so important. This is what I take to heart when I'm teaching, and you can maybe speak on this as well, but it's so important to know where you're injecting, because I think whenever
God,
there's
so
a
important.
problem, or if there's restrictions or difficulties during further procedures, if someone's planning to do a facelift, at least from a lot of the surgeons I've discussed with, it's from the placement being incorrect. And so
Correct.
and that's, if it's in the proper planes, it should never be in the plane you're dissecting or in a problem
Exactly.
area. And so it's I think so important, and it's something that so many people do, but not everyone's trained in. And again, goes back to coming to someone that's board certified, that has the proper training
knows
and
what they're
these
doing.
medical treatments, to know what they're doing for your best outcome at the end of the day, no matter what you're
Absolutely.
doing there and what you're planning to do 10, 20 years from now, right? And so, I mean, I love filler. There's a place for it. It just has to be done properly, and that's the biggest thing.
Let's talk about the safety of that. If you're
Yeah.
going to someone who doesn't know what they're doing,
Yeah,
The complication can be horrific.
absolutely.
You can lose your vision. You can lose skin.
Hmm.
Like there's so many things can go wrong if that filler is injected into a blood vessel. You can
Absolutely.
literally go blind. You can literally have the
Absolutely.
skin on your face die.
Yeah,
So, I highly encourage our listeners, if do
absolutely.
not go to someone who is not board certified,
Hmm.
who doesn't have the proper training
Yeah,
when you're getting fillers. People would just go into fillers like they're going into the hair salon and getting fillers. This is not a joke. This
absolutely.
is
It's
a medical
medical.
procedure.
Absolutely. You're a patient. It's a medical procedure. It's so important. What you're talking about is vascular occlusion, and it's truly about understanding anatomy. Obviously, anything can happen with anyone, and there's reports,
Absolutely.
but you also have to know how to deal with those side effects. If you go somewhere
Exactly.
that,
Knowing how to deal with the side effects. Okay, so you have a complication, can happen to
absolutely.
anybody, but knowing, like you said, how to deal
Yeah,
with it.
absolutely. And having everything on board, having a plan to reverse any possible complication is so important. Having access to your doctor, and just there's so many things that it takes to have the best care, and it's like you said, not something you just pop into a salon for. It's a lot more serious than that. So,
Yeah.
super important to know who you go to see
Look them
for
up,
all
search them.
yeah, for all these treatments we're talking about. Absolutely.
And you have like some of these I'm not against Botox parties if there's a provider that knows what they're
Sure.
doing,
Yeah.
but some of these are just you don't even know who's touching your face and injecting stuff into your
You don't
face.
know what they're injecting. There's case reports recently in the US of patients like,
Oh, I saw that.
yeah,
Fake
like
Botox
fake Botox
causing
truly.
botulism.
Mm-hmm. I think there was death reported. I don't know if I'm mistaken. We have to like look into that. But I know they were in the ICU, like a handful of patients in the ICU from the same provider. And, we don't know where their products are coming from. You want to have a licensed facility. You want to know your provider is licensed. You want to know what's actually being injected into your face. It's your face. You only get one. So do
Yeah.
your research.
I actually treated a patient who had vascular occlusion from another provider, and she
Hmm.
had a bunch of skin dye on her face.
So unfortunate.
And there was a lot of wound care that went into it. I had to take her to the operating room to breed, ultimately do a skin graft. So this was like serious
It's
reconstructive
intense.
surgery. It's very intense and it can
Yeah.
be devastating.
No, absolutely.
Let's talk
Absolutely.
about some other crazy stuff that we see here in
Oh my
Beverly Hills
daily.
is
Yeah.
silicone injections.
Oh, it's
Like
the
it's
it's
the
the
worst.
worst. It's
It's
the
the
worst.
actual
It
worst thing.
literally is the worst. Poor, I don't, again, don't go somewhere
That
that's
are injecting like
unregulated.
industrial grade
Literally from
silicone.
like Home Depot. Who knows where they're
That
getting
actually
this?
happened in
I
Texas.
know.
There was a story about
I
that
heard
happening in
about that.
Texas. And
I did training in Florida, so we saw the craziest cases. I had so many patients that had silicone injections in their buttocks. I've had patients with silicone injected in their lips, and they were at a point where their body was rejecting it, and they were forming bacterial granulomas, and they were
yeah,
oozing, and the skin was dying, and
it's a nightmare.
it's a nightmare.
I took care of a couple patients. One had it injected into her butt, and I
Hmm.
had to go back, and you have to cut it out.
There's no other option, and that's the
There is
thing.
zero
Like,
other
at
option.
least with like a filler, you can,
Dissolve
there's
it.
an
No big deal.
antidote, you can dissolve something if God forbid something like that happen, and that's like rare to none. But silicone, it's like a higher likelihood, and you have no other option than to cut in, and like you're left with deformities. It's so bad. It's so sad for these patients.
Right.
And it's a medical danger.
Yeah,
I
you can
mean,
die
you
from
can
these things.
die.
Just like a
Yeah.
BBL, you can inject fat into the vessels
Hmm.
if you're not careful. You can inject a silicone, and then you can actually die.
Yeah.
These things are, if I want my listeners to know, please know what you're doing. It's
Yeah.
like you said, you have one body. Don't cheap out on a parachute or your
Like,
physician. Okay,
exactly.
those are two things
Truly.
you don't want to cheap out on.
Yeah. No, absolutely. I agree 100%.
Switching gears,
Yeah.
something that I want to talk about are tanning beds.
Oh, don't
Super.
do them. Everyone. It's
I
like
know. I
you're
see.
asking for a skin cancer. Honestly, they have like memes about it, but it's like choose your skin cancer when you walk into a tanning bed. And it's like almost guaranteed the amount of UV radiation you
It's
get in tanning
insane.
beds. Yeah. It really should be illegal. I don't even know. Like every state is different now. And sometimes if you're under 18, I think you need a parental signature or something, but depends on the state you live in. It's so harmful to the skin.
And it's not regulated. No one's
Not at
regulating
all.
it. People walking in, it's unbelievable.
It
The
really
risk
is.
of skin cancers, does it double it, triple it, or we don't even
It's
know?
even more than that. I think because it's so unregulated, we don't know how much energy, but it's even more than double. I think it's like, and I don't want to say a number, I'm not positive, but it's significantly more. And we do know, like, again, the different levels depending on where you're going. No one's actually regulating how much energy you're
No.
getting. And so I say fake it till you make it. Get a fake tan, you can
What do you think about
buy it,
those? Like a
honestly, way better than a tanning bed. I will vouch for my parents, patients, not parents, and parents if they ever wanted to. But I would
why not?
vouch for my
Why not?
patients. Sorry, I don't even know why that came out. Patients to fake it till you make it. Get, sometimes patients that have sensitive skin can have some irritant contact dermatitis to some of the topicals or whatnot, but it's so much safer for you. Way better. If you're going to do it the safest way.
Right. So no to tanning beds, obviously.
Yeah.
Tanning sprays and stuff.
Yeah. Yeah.
Look at the ingredients. Get something that comes from a reputable company.
Exactly. And we say in derm all the time there's no such thing as a safe tan. So really, like, even when you're laying out, and if you're trying to people are like, I only did it for a couple minutes, or I want a base tan before I go on vacation. Once your skin is actually tan, that is just proof of DNA damage on your skin. Your body is literally fighting to try to protect by creating more melanocytes. So, you know,
Right.
there's no such thing. And if you want to put a cream on that looks tan, go for it. But that's as far as I would take it.
I said my joke. The biggest compliment to me as a plastic surgeon, and when I see a patient come in post-op,
Mm-hmm.
and I'm in, mommy makeover, and there you see the tan lines that they're wearing their bikini,
Yeah.
and you see they have the tan below. It's like, oh my God, great, you're showing off your body,
You're
but let's be
comfortable.
careful in terms of,
Sure.
preventing you from getting a skin
Yeah.
cancer.
No, I love the confidence, obviously. That's one of the best parts of our jobs, and we're
Yeah.
so blessed to be able to help people in that way. But just stay safe in the sun. Wear your bikinis, but put your sunscreen on.
Yes.
And then reapply
yes.
every 2 hours.
Enjoy your bikinis.
Exactly.
And, we're winding down in
exactly.
summer, but it's still important for the weeks we have
Yeah.
left.
We get UV rays all year long, and I think that's another misconception is like when it's the 1 week in LA where it's like gloomy and
gloomy.
raining.
Yeah. Or
You
not, the
do
sun isn't out.
exactly.
You can
You
still.
still can get, you still need sunscreen. You need to protect from the UV radiation, and so no matter what the weather is, and some people, don't even realize it as well, but you get almost double the UVs when you're by water or by ice. So like for patients that ski or snowboard, you're getting both the UV from the sunlight, but you're getting the reflection from ice. So no matter what the season where you are, same with the ocean or lakes or whatever body of water you're near, you get the reflection bouncing from water back onto your skin as well as direct sunlight. So
If you're skiing or snowboarding,
you need sunscreen. Just wear your sunscreen. Wear the sunscreen.
So let's talk about acne. When I was younger, I had acne. We
Yeah.
tried everything. I went to those freezing nitrogen things. I remember as a kid going. I took doxycycline. I went on Accutane ultimately.
Yeah.
What is the newest and best practices for acne?
I mean, you hit a lot of the same medical standards. There's not so much that's changed because, we know historically at that time what triggers acne, but it is multivariable. So I think it's important to understand the most common causes, but in females a lot of times too, hormones can obviously play a huge role. But if you're genetically predisposed, you have an oily skin type. For males, testosterone production as in your teenage years triggers a lot of oil production. For bodybuilders that take supplements or even whey protein has correlation to acne. So all these little things play roles in it, but it is multifactorial. And it starts by a congestion of a pore, and that starts with a comedone, which is a little bump. You can get inflamed where bacteria gets thrives on that as a food source, and it gets red and inflamed. You can get severe acne as well that's cystic. And so there's levels of acne from mild to severe. One of the first line treatments, no matter what level, we were talking about retinols, but there's prescription tretinoins, and the strongest form is Accutane in the oral form. They're vitamin A treatments.
I took that.
Yeah.
I remember those days.
And it's the closest thing to a cure, and it's still the closest thing we have to a cure. I think Accutane is such an amazing medication. Lots of misconceptions. I've given it to thousands of people. It's the best thing they've ever done when it comes to their skin. There are side effects, of course, that we monitor, and you can't get pregnant on it, and that's why it's so strongly regulated.
And you have to be on, from my understanding, if it's a female who's above, kind of after puberty, do they need to be on birth control while they're taking Accutane?
Yeah, so legally there's the system of iPledge, which I'm sure you're so familiar with too if you've done it. It's like the administrative side, but you have to have 2 forms of contraception.
2 forms.
If you are sexually active. Abstinence is also considered contraception as a single form.
That was not as fun.
Yeah. So, depending on, their age or what they're doing.
We're talking about girls after the age of 18.
So, but yeah, there's the legalities of Accutane. You can do either. But if you are sexually active, you need 2 forms of contraception. And so it's just, there can be malformations as a fetus is developing if you were to take it without, if you got pregnant while you were taking Accutane. So they want to regulate it. Of course, that can happen with other medications, but this one is just more regulated.
Right. So again, the point I want to get across here that
Hmm.
it's a safe drug. It's been proven. It's been tested, and
Absolutely.
people should not be afraid to treat their acne.
100%.
And from what I understand is that the earlier you treat it, the less scarring and things that you have. So if it's something
Exactly.
that you can prevent from happening and scarring,
Yeah.
kind of get that treated early.
Yeah, and I encourage patients and parents, if you see your children starting to break out and having acne, it's really important to get them into a skincare routine if it's pretty mild. We have many options of how to treat it. We have to always evaluate which type of acne a patient has to get the best treatment together. But it's exactly right. You want to get ahead of it early so you can try to prevent as much scarring because that can be
Right.
deformative. And I know we've been talking about sunscreen so often, but for many patients, they get acne scarring that's pigmented or those post-inflammatory erythema or hyperpigmentation scars triggered by acne. We were talking about that with other scars, but wearing sunscreen is so important because when you have active acne, when you're exposed to sun, that's going to pigment even more likely and it's harder to fade. So,
Right. So if you were to kind of give us an overview of kind of mild, moderate to severe acne,
yeah.
what are the treatments that you go through? The
Yeah,
mild forms,
absolutely.
moderate, and
Yeah.
severe.
In my practice, I'm open for Accutane for any patient that's starting to have it because let's nip it in the bud if you're willing and wanting to do it. But truly, the medical recommendation for mild acne, which is considered more comedonal, it's not necessarily inflamed, just more congested skin, are topical treatments like a tretinoin because you want to exfoliate the skin. You want that skin to be turned over to decongest the skin.
Hmm.
So it's number one preventative, but also very treatable in its nature. Secondarily, if a patient has more moderate, where you're getting more erythema, inflammation, but more superficial still, we want anti-inflammatory antibacterials included from topicals like clindamycin, benzoyl peroxide, or orals like doxycycline, like you were
Hmm.
on, because there's a lot of anti-inflammatory properties in some of the tetracycline medications, not even at an antibiotic dose, but even just a lower dose, as well as tretinoin. When you get more severe, Accutane is really like the best gold standard if patients are open to it. And then there's a sector that can fall into mild, moderate, or severe that's very hormonal for a lot of females. And there are oral hormonal regulating medications like spironolactone, which is really popular. They came out with a topical spironolactone
Really,
called
that I didn't know.
Winlevi. Yeah, it launched, I think it became FDA approved either 2 or 3 years ago. We've been using it in practice. You can use it for men and women. It has both like anti-inflammatory properties as well as decreasing oil production, which is the initial trigger. So it's important to kind of, come up with the best routine depending on the subtype of acne you have. Always important to see a board certified dermatologist just to like learn your skin type, kind of evaluate what's going on, and then we kind of formulate the best plan to go from there.
The only thing I remember when I was on Accutane is it really dried me out.
Yeah, that'll happen for everyone. So that's
Yeah,
like, the main side effect is dryness. It's
yeah,
destroying your oil glands, and so the side effect of that is dryness.
I remember that. That's the only thing I remember
Yeah, and
when
the
I was
lips
younger.
tend to get the most dry. They're the most sensitive
Yeah.
to that side effect. But as long as you stay hydrated, I always tell all my patients to like literally carry a lip balm everywhere you go. Carry those like little Vaselines or Aquaphors with you. Hydrate your lips always. And people do well. You just have to prepare for it,
Just have to prepare. And again,
Yeah.
that really takes care of this for most, if not all,
Yeah,
patients.
absolutely. And that's usually like the severity there, of what patients go through. There's obviously a lot of other things, but that's like the commonality that most patients will go through.
So you mentioned retinol.
Yeah.
What is retinol? Why is it important?
Absolutely. Retinol is a vitamin A derivative. It's a topical that helps turn over the skin. So, by being able to turn over the skin at a faster rate than the natural process, you're able to induce collagen. You can correct fine lines. You can help smooth out texture. It's one of those things that just gives you the best glow topically and should be in everyone's routine as long as you're not pregnant or breastfeeding as a female. And honestly, if you're doing that, you're doing so much. You're ahead of the game if you want to be stable on your skincare routine.
Guys and girls.
All you need to do. Yeah, absolutely.
So if you were to break it up in a nutshell for women,
Yeah.
what's the basic nighttime, morning time routine?
Morning, wash your face, moisturize and sunscreen. At night, wash your face, retinol and moisturizer.
Done.
Done. Easy.
What kind of retinol do you recommend?
There's many on the market. I think a medical grade, you will know that it's stabilized, it's been tested versus some of the over the counters, but there's a lot of great ones. I don't want to plug a brand specifically, but
Right,
I
but
think looking at like a medical grade company that's tested their products is super important.
so we're sitting here. One of our producers here asked, A toner. Do I need a
Yeah.
toner? What is a toner?
Toners are not needed. I tell my patients all the time, like, if you love it, you can use it if they were like committed to one. But toners were made centuries ago to create pH balance in the skin. Many, many years ago, when skincare was formulated, it created some unbalancing in your pH levels because the soaps were so strong that toner was there to create a pH balance. At this day and age, all these products are regulated for normal pH balance. You don't need a toner. And many times, toners actually can be more irritating for patients than helpful. I have some patients love it and like it's mixed into a micellar solution to take their makeup off. It's fine to use, but it's not a necessary step. So don't go out of your way to buy one. Sorry for the
Great.
toner companies.
Great information.
Yeah.
We're here to be unplugged,
There we
uncensored,
go.
say it like it is.
Yeah, just the truth. Science backed, honestly. This is all
Yeah.
research and science backed.
And again, it's an interesting that a lot of things that are we talk about for skincare, for scar care, it's just basic stuff that has been scientifically proven
Right.
without costing an exorbitant amount of money that people are trying to really market this stuff
Absolutely.
and sell it to poor people who don't even know that they don't need it.
need it. You don't
Yeah.
need it. Absolutely.
All right, guys, thank you for joining us for another episode of Secrets of the Scalpel, Beverly Hills Plastic Surgery Exposed with Dr. Ariel Ourian, double board certified plastic surgeon. Thank you, Dr. Hakim, for joining us.
Okay.
For our listeners, where can they find you on social?
Sure. My social is Beverly Hills Derm, and I practice at Davina Dermatology and Cosmetic Center here, right upstairs from you. And that's my practice right upstairs. Also has a Instagram called Davina Derm.
Perfect. So again, thank you for your time. Thank you for joining us.
Thank you.
We have a lot more good episodes coming out, a lot of exciting guests. If there's something you want to know about plastic surgery related, drop us a DM, let us know. We'll be happy to talk about those topics. We will see you on the next episode.